105.9 Academy FM.
The sound of Folkestone.
My name's Tanzidah and I'm sitting with Dr. Claire Evans and I'm going to talk to her about depression.
Hello, Tanzidah.
So what does it feel like to be depressed?
Well, I think it feels different for many different feelings for different people. So a lot of people would feel weepy and down and finding life sort of hard going and having difficulty getting themselves motivated. But other people may be very irritable and they may be grumpy, bad-tempered, withdrawn. And actually, the main feature of depression is you're not your usual self. So if you can sort of think, well, this isn't me, then one of the things might be, am I depressed? You know, because if you're a grumpy person, being grumpy doesn't make you depressed.
Right. So is it noticeable?
I think if you ask people around, has their family member been behaving differently, and people actually stop to think, they probably would say, yes, she's been more irritable, she hasn't joined in as much, or she cries more often, or she seems bored. But it's quite variable between people, and that's why sometimes we don't recognise it.
Oh yeah, I understand. So what gets people generally depressed?
Well, that's a very good question, because actually we don't know the full answer to that. Obviously life events can contribute to people becoming depressed, but there is also a genetic component, and it's probably an interplay of both those things, life events and your personal makeup. There are times of life when people are more at risk of becoming depressed, like women after giving birth to children. Postnatal depression, and that time is a very high risk time for becoming depressed. And also certain illnesses can be associated with depression, and often bereavement can be associated with depression. And in young people, bullying is often a trigger for depression.
Yeah. You said a few seconds ago that you can get it genetically. How does that work?
Well, there is research that shows that some families, some people, their risk of depression is much higher than other people. And obviously this is proper genetic studies would be shown on, separation of twins. But it's variable. And some people, with nothing happening in their lives will go into a very, very deep depression. That's unusual. The majority of us are somewhere in the middle. It's a combination of life's events and our makeup.
Thank you. How do you deal with depression?
Well, as a GP, there'll be a lot of people who are depressed who never come to see me, and that's sad, and that's why maybe conversations like this on the radio are helpful. But when somebody comes in to see me, some people will have in mind that they might be depressed, but an awful lot of people won't. They might be really anxious about their health. Quite often people present with, health anxiety. Some people may be really irritable, and you have to, first of all, take a history, sometimes do blood tests, because conditions like when your thyroid gland is underactive could be mistaken for depression. But if you can talk to someone, you often get a feeling of how they are. And then if you think there's depression, we will usually use a set of questions which are pretty formulaic, really. We will ask about, is your sleep disturbed? Is your appetite disturbed? Are you losing interest in things that you're doing? Do you have, kind of a lot of negative thoughts? There's a list of questions. In fact, we actually have a table, and we can ask someone to fill it in, and you can actually give a mark out of 27, how much they score. That's quite helpful. It's also helpful for when they come back that you can see how they're doing.
Oh, and do it again to see if you've gotten better.
That's it, yeah. And sometimes people think, oh, I'm no better, or oh, I'm a load better, and actually you can do it and you get more of a kind of quantification of it.
Yeah, so the statistics help.
Yeah, numbers do help a bit, yes.
How successful is self-help?
I think self-help can be very successful, and actually the mainstay of depression is for the person who's got the problem to recognise it. Quite often just recognising it and talking with someone about it is the beginning of getting better. And a lot of the programs now really are based around self-help. I've got one here to show you actually, but quite a lot of the CBT, which is cognitive behavioural therapy, is actually given as like a booklet or an online program which you can follow. But for self-help to work, you've got to recognise that there's a problem and you've got to want to do something about it. And when you're depressed, it's very hard to get motivated. And so I think, having somebody supporting you or a doctor who's supporting you to actually kind of, how's it going, how are you feeling this month, is a support to the health self-help, really.
Is medication the best way to deal with depression?
I wouldn't say it's the best way. It's certainly one way, and it's very effective, and it usually has the advantage of being pretty quick compared to, most depression will get better on its own, but the kind of time scale we're looking at is sort of 6 months. Not nice to feel really down for 6 months, whereas the antidepressants usually start to work within two weeks, really. 2 to 4 weeks, you'll get quite a good response.
Oh, that's nice.
I think you've really got to try, I try and review people on a monthly basis. First of all on after 2 weeks to see they're responding, and then another 2 weeks, and then if things are going well, I'd see them monthly. But if after 2 or 3 months there's no progress, then you want to consider either a different treatment, or you might consider referring them at the very beginning, the first things I would offer people would be self-help, counselling and antidepressants. But then to review them and to reconsider things. What's going on? What can we do to change it? One thing I always do when I see people who are depressed, I as part of the diagnosis, but also as part of the treatment, I go through, what's your sleep pattern like? Because sleep is absolutely essential. It's often disturbed if you're depressed, but it's often that you're not sleeping properly because you're sitting up all night, and then that's not helping. So first of all, to get your sleep better, then to look at your diet, which not everybody eats as healthily as you, and there's quite a lot of evidence that a healthy diet does help. And, that includes oily fish and the omega-3 fish oils that you find in those fish. And then exercise, encouraging people to do exercise. So I actually make people write a little timetable, like a little tick box. So they have 5 things, and the things are sleeping, eating, exercise, socialising. For some people who are depressed, they've actually become so withdrawn they don't even go out. So you might even just encourage them to go and buy a paper and chat to the person in the shop. But for somebody more like you would say, now you must phone your friend and arrange to do something, sort of every couple of days. And the 5th thing I always do is trying to encourage something which is creative, something that you can lose yourself in. At the very beginning of depression, that's really hard. But to say, I'm going to do something I really like doing, painting, music, cooking, anything that you can say, oh, I've achieved something. It might be a tiny thing if you're down. But depression, if it's not getting better, you really need more help, and you need to roll out the big guns. Get to see a psychiatrist. Try much more. There's such a lot of help around. It's not something to suffer for a long time. It is really unpleasant. You're missing out on actually living. It's really sad. And some people, they just say, how did I put it? Oh, I'm just grumpy, I can't be bothered. I think especially with teenagers, they say things like, oh, I can't be bothered. But actually excessively can't be botheredness is really not normal and is a sign of depression.
What are the different talking therapies?
Well, at the minute, the sort of flavour of the month is CBT, which is cognitive behavioural therapy, which is trying to change the thoughts you're having. You kind of, if you're depressed, you tend to go around saying, oh, I'm no good at this. Yeah, that's typical. That's happened again for me. And cognitive behavioural therapy is trying to change the thoughts you're having that might perpetuate those feelings. That is one of the few therapies, at least I believe it is, that's actually been evaluated.
Oh, so you need to think positive to be positive.
Yeah, but it's hard to recognise when you're not thinking positively. If you've always been thinking in a slightly negative way, in the past, we've done a lot of psychotherapy and counselling. Some of those therapies haven't been evaluated, and therefore they're not sort of recommended. But that's only because it's very difficult to evaluate certain therapies. I think the main thing is somebody to talk to who you can relate to and trust, and actually look at changing some of the patterns that you're doing in your life, really.
Yeah.
But sometimes if it's after a bereavement, just having some bereavement counselling with an organisation might help as well, because bereavement is quite a trigger. And I should imagine at schools bullying is actually quite a trigger as well. And there are bullying sites that help, and just to recognise that that's got you down would be helpful.
Yeah, that sounds helpful. Does culture have anything to do with depression?
That's a really good question. What do you mean?
Maybe like some people's cultures might restrict others, and it could be a bit
I think if anything in your life is making you feel restricted and it's imposed upon you, that would make anybody feel at risk of becoming depressed. If there's a conflict, between, for example, if your parents were trying to make you do one subject and you really didn't want to do it, sort of conflicts that you can't resolve make any of us feel uncomfortable, I think. And the main thing, I suppose, is to try and talk that through with someone who's independent, who's not on one side or the other.
Is depression linked to childhood memories? But you said earlier that it can be it's different for people, right?
Yeah, I think everybody's different, the components of making you at risk of getting depressed. But I think that's a really interesting and thoughtful question, because people who've had difficult childhoods are very much more vulnerable to life's events, to things going wrong. And if you've had a difficult childhood, often your self-confidence is lower. Often you haven't learned good self-care. And so some people are particularly vulnerable to getting depressed. And we see that a lot in surgery, people who've been abused when they were young and had difficult times. There is, I believe, some evidence that if you've suffered a bereavement of one of your parents in early childhood, that increases your risk of depression. And obviously, if some families have a lot of disruption, that may be because there's depression in the family, so there may be a genetic component there as well.
Oh yeah, I understand that, yeah. How do you make others understand about your depression?
That I think is really central to getting better. What I do when I see people is I try and explain to them what depression is, because a lot of people think, oh my goodness, I'm going mad, or I've got a mental illness, there's something really wrong with me. Depression is a very, very common illness, and to a mild extent, probably more than half the population will suffer from it. But to try and explain to somebody, what it is, that it will get better, that it's not a failure of kind of moral fibre or whatever, is really helpful. And I usually give a printout which explains depression, so that the person can read it and think. Sometimes if they're really, not keen on the idea, I say, go and read it. Maybe you haven't got depression, read it and see. But if they've read it themselves and they find it helpful, I say, no, make sure that the people around you, your husband or your mother or the people that matter to you, can read it as well, because it's not an easy thing to understand if you've got no experience of it. And quite often, if you can get people around you to support you and understand, to think you're not irritable because you're bad-tempered, you're not irritable because I've done something wrong, it's because that's how you're feeling, then you can actually start to make changes, and that can...
Yeah, others need to understand as well.
Yeah, others need to understand to be able to support you.
Is it really serious, depression?
Well, of course it can be, because, what we're always concerned about is this person at risk of harming themselves or suicide at the worst.
Yeah.
So it can be serious, but the majority isn't, and the majority we can help a lot, and the majority gets better reasonably quickly, and people, I think, learn from their episodes of depression to care for themselves more in the future and to have more sympathy for other people.
Thank you for